Despite the incredible efficacy of Nivo-Ipi, there is still some patients who have progression of disease, innate resistance. In Nivo-Ipi, it's about 10%. For Nivo, it's about almost 20%. We still don't understand the mechanism of innate resistance because there is not an acquired resistance. So this needs to be looked at, and a lot of biomarker research is looking into that. I also think that maybe combination treatment may be something very important to look into to further increase the efficacy. The efficacy is already amazing, but that would be very important. I think that understanding who will have a complete response, which is about 30% in both arms, would be also helpful. Because if we would have that technically, we would only needed to treat with Nivo alone and not with a combination, which shows a little bit higher side effects, but not overall medically concerning. So I think the biomarker research for predictive outcome in order to decide and really personalize the treatment may be very important, and for the resistance, what potential combination may be even more effective.